Gregor Prosen put this slide presentation together for us.
Hi, I will be presenting Malaysia together with Dr. Shaidan, the chairman for WinFocus Malaysia, together with Dr. Shaidan and STPs from Singapore. Sorry. As you all know, this is Malaysia. It's a small country, 27 million population. Yes, we used to be famous, I think, a few years back, for the record, because we keep on using plane. As far as ultrasound are concerned, I think it's quite new. We started back in 1995, and of course, after 2009, when we have our first WinFocus course in Malaysia, then everything started there. Never looked back after 2009. When we talk about CPU training, as far as medical students are concerned, I think ours is more fast. We're still in the initial phase to implement this critical emergency ultrasound in our medical student undergraduate program. But as far as residency and training of practicing physician are concerned, we already started it for the past 5 years. And of course, when we talk about challenging in training of this emergency critical ultrasound, I think it's almost similar. When we first started way back in 2002, people a bit skeptical about, a lot of people are skeptical about what we're doing. They thought we're actually trying to introduce a new religion in medicine. And of course, there's a lot of tough war between specialty, even in the same specialty. And of course, the most important thing is the things that I think we haven't sort of solved now is the sticky part of this credentialing privileging, in which I think probably our main topic for the next few decades, how we're going to go about this very sticky problem. And in terms of financial issue of training, we don't have issue in terms of residency program in Malaysia, because we're actually using the existing fund that we provided for this MN or residency program. We have a plan to introduce this ultrasound fellowship program somewhere next year under UITM program. But of course, we're going to model US emergency ultrasound fellowship program, and it's going to be something like the 9 to 1 year program. And in terms of funding, we already have a discussion with Ministry of Higher Education in terms of funding, and we're actually trying to convince Ministry of Health to have some form of funding in terms of starting this kind of program. Financial issue in terms of training, I think before 2012, our training program in Malaysia is heavily dependent on industry. And of course, after 2012, after we have our own society, we are sort of become independent, and we actually generate our own income based on the registration fee. And because of that, we are now less dependent, and of course, we're not biased now with the brand that is actually offering more sort of ultrasound model that is available now. And we're actually running our own courses in Malaysia. We also run courses in, we started the courses in Indonesia together with Lukaneri since 2008. We are going into Brunei now. Of course, we're helping up our friend from the Philippines to set up their own ITU. And started last year, we started to go into Vietnam to introduce this emergency ultrasound. But based on our experience, I think the most important thing that I noticed is to introduce this kind of training in a so-called developing country. If you're too much dependent on industry, you can't move anyway. So we are trying to sort of empower some of our colleagues from Indonesia, Vietnam, from other countries, that the best model will be a self-driven and of course to become as independent as possible. And in terms of competency and certification, we don't have a uniformity based on policy. It's actually based on local policy, and there's not yet a national standard policy. So I must say it a bit difficult for us. We have a long discussion with a lot of academy, a lot of society to come up with this standard policy. Even though I think a lot of policy that actually became model, but it's still under discussion, and then a lot of the hurdle we have to go through before we come up with this policy. And in terms of competency, we actually base 100% on WinFocus USLS ABLS provider certification as our guide now. So, thank you.
So we are back to the issue of position cooperation. I guess over the past 7-8 years since WinFocus was introduced to Malaysia, I would say the main bulk of practitioners and also enthusiasts came from the emergency fraternity. But over the years, we have seen that anaesthetists, intensivists, physicians, and surgeons are now on board, even though still at the moment the majority of our, I would say, main players are still emergency physicians. So, but we have seen societies like, for example, last year we had the Thoracic Society, Malaysian Thoracic, inviting us to run a lung ultrasound workshop. We have the Malaysian Intensive Care Society inviting the WinFocus, Malaysian WinFocus group to run WinFocus USLS, as well as a WBE kind of a modified WBE pre-congress workshop. So we have seen this kind of collaboration, and hopefully in the future we'll see that critical ultrasound, clinician-informed ultrasound, will probably not be very skewed towards emergency medicine. Okay, what about opposition? I would say we were quite fortunate because there weren't very much opposition. We, at least not officially, we have heard radiologists claiming or asking us through unofficial channels where is the authority for us to actually teach other medical practitioners to use ultrasound. But of course, I think we practice by ignoring them. We kind of silence their position in a way. We have engaged them in actually dialogue in some of our I would say communication with them, but generally our position is not very stiff in Malaysia. With regards to charging, as far as the government services, or I would say the public services, we do not charge. So we do not make money for when we do point of care ultrasound. Of course, this is probably not including obstetrics and gynecology. But I think even in the private practice, when physicians do practice point of care or clinician-informed ultrasound, the charges are usually not very lucrative if it exists anyway. With regards to endorsement, the College of Emergency Physicians, as mentioned by Adi, has acknowledged, has endorsed point of care ultrasound and adopted the WinFocus syllabus. Not many other specialties have actually at least document. They have accepted it, but probably not so well documented the endorsement. Okay, probably finally, as Adi mentioned, we like to think that our Southeast Asia, we are kind of brothers. So we have, these are the areas that we have actually done courses from Manila, Brunei, and Bandar Seri Begawan, and these are the various cities in Indonesia that we have conducted, and we hope that actually to kind of establish the local or national societies so that they can run on their own. I think with that, I thank you. This is we have the haze. At the moment we are having a problem with the haze. Thank you.